Right. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على رسول الله وعلى آله وصحبه ومن والاه. أما بعد, السلام عليكم ورحمة الله وبركاته. Welcome back to our discovery journey, how Islamic civilization impacted the West. And today we want to focus on development of hospitals, development of medicine, Islamic medicine in general, and medical knowledge. But before I start, this is the references I have used for preparation of this presentation. I recommend this book, 1001 Cures, Contributions in Medicine and Healthcare. I think there's an online version. You don't have to buy it. There's plenty of very good information. And this UNESCO publication, the different aspects of Islamic culture, is also very interesting. It has got a lot of details, covering the history of medicine in the Islamic civilization. I want to make a disclaimer because the content of this presentation has a little bit of medical information. So this presentation is about the history of development of Muslim medicine and how it impacted Western medicine. I'm as a presenter, I'm not a medical professional, and I did not receive any kind of medical training. Therefore, the content of this presentation should not be construed as a medical opinion or medical advice of any sort. It's purely a reading of Muslims' rich intellectual history in medicine. That's it. So let's start with, just to give you a bigger picture of Muslim medicine. Muslim medicine was initially informed by the work of ancient Greeks. Like many other areas, Muslim, they took knowledge from the Greeks, and which was disappearing at that time, and they translated into Arabic. Okay, this was taking place in the House of Wisdom or Beit al-Hikmah. We've covered that. And there was a massive translation movement, in the 8th and 9th century. So particularly, we're interested in the work of Hippocrates and Galen, because these are the major Greek physicians that really informed Muslim medicine. Now, but the Muslims were reading only text because there was no any example of a hospital as such. And in fact, the Greeks, they never had hospitals in the sense that we know them today. They had more like, temples of healings rather than you can say, evidence-based medicine that is based on science. All right. So this body of textual knowledge that the Muslim got it from the Greeks, immediately it was transformed and it was expanded through research, through practice and experiences of these great Muslim physicians and polymaths. So the value addition of the Muslim, all right, is this pioneering of making medicine scientific, you approaching the medicine in a scientific way. So they introduce experiments, they introduce evidence-based medicine. This is a buzzword that most of the modern medicine keep referring to. Everything, you have to have evidence. When you go to a hospital, the doctor is not rushing to prescribe a treatment. First of all, they do observation, they will do a lot of tests, They will do X-ray, they will do blood tests, they will do all of sort of things in order to build a case. So this is what is referred as evidence-based medicine. And they did clinical trials, and they also did post-mortem autopsies. So this is the area that really Muslims contributed, and this is how the modern medicine is performed. Now, if we look at the development of hospitals, in the medieval period, Europe, they didn't have hospital as the way we know them today. Simply, they did not exist. There was some kind of help that was given through monasteries. They will have like simple dispensaries. They will care for patients with specific diseases, usually incurable diseases. And it was, more caring than actually curing, all right? And surgery was not even an option because surgery did not exist. In fact, the church already banned, any form of cutting bodies in the 7th century. I give you a reference of, you can read about that. Most often, these monastic hospitals, if you call them, or dispensaries, they were in fact just a convenient places for destitute people to die relatively with dignity and comfort. But it wasn't really meant to be, a place where people, they can expect to be cured. So the idea of a medical hospital as the way we know it today, in terms of its facilities, in terms of its services, and in terms of being evidence-based, it was first imagined and introduced by the Abbasid rulers. The first hospital was built by Khalifa Harun al-Rashid, all right, in the early 9th century in Baghdad. And then it followed by the one that was built by another ruler, a ruler of Egypt, Ahmed ibn Tulun, towards the end of the 9th century. So these are the first hospital in the way that we know hospitals. I want to point out to one thing, because when you research about Muslim hospitals and medicine, you will come across this word Bimaristan. Now, because in the beginning, hospitals were known that way, and this word, actually, it is adopted from Persian. There are two words that have been appended together. Bimar means meaning sick, and Istan meaning home. So when you combine them, it makes a home for the sick people. So when if you go to places like Syria, if you go to even in Egypt, you might find some of these hospitals have been labeled as Bimaristan as opposed to hospitals. All right. Now, a Bimaristan it consists of a complex, so it's buildings. It could be multiple buildings to house patients, physicians, researchers, and administration. But also it had other facilities for providing medical services. And it was almost a rule. Patients were admitted on equal basis without discrimination. And you'll be surprised, as I was reading, I was surprised myself. Inpatients, those who are going to be admitted in these hospitals or Bimaristans, they were given special ward clothes before assigned to their beds. And the clinical treatment was administered at their beds. And therefore, this is exactly like the hospitals operates today. 1,000 years ago, the way they operated their hospitals is exactly like the way we do it today. Now, the typical medical facilities for a Bimaristan or a hospital included an outpatient wing, inpatient wing. There was a psychiatric wing. It's just amazing that people, they cared about the mental illness from that time. There was a pharmacy or a chemist. There was a medical library. There was a hall for discussing medical cases. there was a dining hall, and also they had bathhouses. All right. Just to, to indicate the importance of hygiene at that time. So some Bimaristans, they had also facilities for teaching and training medical personnel in different specializations. And the common specialization, that are recorded, surgery or general surgery, ophthalmology, which is something to do with the eyes, so it's more like eye clinic. And then you have a clinical medicine, internal medicine, you have pediatric or medicine related to children, you have orthopedic related to bones and fractures, and you have physiotherapy, you have beginning of dentistry, and you have pharmacology. Now, pharmacology is totally an invention of a Muslim, because they advanced this field so much. When the Europeans during Renaissance, when they established their pharmacology industry, most of the information, it was already there. Now, this is an example, another hospital that was built in the 13th century in Egypt by Al-Mansur Qalawun. He was a Mamluk ruler of Egypt. It was built in Cairo, all right? And in this hospital, it had a female ward and male ward. And it is surprising that these wards, they were served completely by physicians of its respective gender. So there were many female Muslim physicians, all right? And this particular hospital, it also had a teaching wing. Now, the building exists. I'm not sure today whether it functions as a hospital or maybe it's a museum. But many of these hospitals, and I'll show you some pictures, these are buildings that they have survived almost 1,000 years. Now, what strikes me is the constitution of Al-Mansur hospitals, which reads, the hospital duty is to give care to the ill, men and women, until they recover. It served the powerful and the weak, the poor and the rich, the subject and the criminal. Even people who were criminal, they were afforded medical care, all right? And everything was given for free. It also says all the services are provided for the sake of Allah, who is the true provider. So this idea of private hospitals and people paying a lot of money, for hospital because they are looking for some alternative to, public hospital, it did not exist at that time. You can get good care, for free. In the Islamic civilization, because care for the sick is part of the teaching of the Quran and the Sunnah, and therefore this development became very important. So the early Muslim hospitals, they treated people equally without discrimination. It didn't matter your faith, your gender, or your socio-economic status. Now, medical care, as I said, was free for everyone across the Muslim world and throughout the Islamic civilization. Until when Islamic civilization declined, medical care was free. And it includes everything, treatment, hospitalization, medicine, and food if you happen to be an inpatient. Now, how was it supported? It was supported through Waqf or Islamic endowment, and it was really hospitals that were run as a philanthropic, and they were run with humanitarian principles. There are many hospitals today, they are driven by profits, and therefore sometimes care is compromised, all right? The Muslim in that time, they understood that. This is the floor plan of Al-Mansur Qalawun Hospital, which I just showed you before. And it shows these different facilities. This gives a clear indication that, hospital, as the way we know them today, were developed a millennium ago in the Muslim world. This is another 13th century hospital in Anatolia in Turkey, and this has become a UNESCO World Heritage Site. Now, hospital was the most important institutions for public health. Physicians were highly valued and respected. Some of them, leading ones, they were recruited by rulers, and therefore they had access to resources and the final decision makers. And that's why this area developed so much. The general purpose for running hospital was not only to cure individual, because they look at it in a bigger picture of improvement in community health. And hospitals also became centers of medical scientific investigation into diseases, their symptoms, their causes, and their treatment. So hospital became research centers at the same time. And of course, hospitals were also developed for teaching and also for giving practical on-the-job training of medical personnel. All right. Now, just to show how sophisticated these hospitals were, in the Middle Ages, if you are in the West, okay, leprosy, this is a disease, you can see the picture. This disease has been mentioned in the Quran. I think Sayyidina Isa alayhi salam, he was given a miracle of treating leprosy. In the West, it was condemned. If you suffer from leprosy, you will be condemned, because this was seen as a sign of evil, and they did not consider as something that requires medical treatment. But in the Muslim world, at that time, leprosy was treated in the medical facilities. There were some isolated wards, and this is recorded in the hospital of Qayrawan in Tunisia and in An-Nouri hospital in Damascus. All right, you could get treatment of leprosy 1,000 years ago. Muslim medicine was driven by the concern of human life and medical ethics. The first document on medical ethics in the Islamic civilization is more than 1,000 years old. Only recently in the West, people have started to be concerned with the medical ethics. And there are many horrible stories related to the modern medicine when it comes to ethics. Al-Nouri Hospital in Damascus was the first to employ medical inspectors to verify that medical care that is delivered was meeting certain standards or certain high standards. By maintaining this idea of accreditation or audited standards of services, Al-Nouri Hospital became one of the first teaching hospitals in the world. Physicians were required to have rigorous medical training and on-the-job practice in a teaching hospital, such as Al-Nouri Hospital, to gain experience, and they were given ijaza or authority to practice. Much like doctors of today, they get their medical degrees. I think there's a hadith of Prophet Muhammad ﷺ to warn people not to practice medicine without knowledge. Okay, so people were inspired by these kind of teachings. Now, what you see on the right, this is a ijaza that was given by Ibn al-Nafis, who was a physician, very famous physician, who practiced in Al-Nouri Hospital. And this ijaza was given to his student, and by the name, it looks like he's a Christian, Shams al-Dawla al-Masihi. And this particular ijaza, he certified that this student mastered Ibn Nafis' commentary on a Hippocratic treatise. So this is not a general ijaza, this is a particular. And this ijaza was signed by Ibn Nafis himself, and this is preserved in the National Library of Medicine in Washington. Now, hospitals were first introduced to Europe via areas under Muslim rule, such as Spain and Sicily. And from there, Muslim hospitals and medical knowledge it started to proliferate to the Christian Europe beginning in the 12th century. Now, I will mention this first medical school in Europe, Salerno, which is in the south of Italy. This is considered the first Western school, teaching Muslim medical curriculum, and in the 12th century. The school itself, it was found in the 9th century, and it started not as a school, but as a dispensary of a monastery. Just because of its location in the south, as a Mediterranean port, it is close to the, Arab ports in the Mediterranean. And therefore, because of this proximity and because of the trade content, Salerno had a lot of Arab influence and culture as well. So many medical textbooks of famous Muslim physicians, such as Rawahy, we'll speak about him, Ibn Sina and Al-Razi, arrived in the city Salerno by sea. And these were the books that were translated from Arabic to some local languages. And therefore, about the same time that the Muslim medicine flourished, this was the first organized medical school in Europe teaching Muslim medicine. And in the 12th century, you are talking about already 400 years into, the history of Muslim medicine, all right? Because the Muslims started way back in the late 8th century, early 9th century. Now, although Salerno did not produce a brilliant genius or discover something fantastic in medicine, but it was important in helping to parent other medical schools and hospitals in medieval Europe. So, in Montpellier, in Bologna, Padua, and Paris, people will go to Salerno to study, and there is a knowledge transfer to these places. Okay, so that's cover the development of hospitals. All right. Now, I want to move to another topic of surgery. If we journey back to history, in the 10th century Spain, we will meet this cutting-edge Muslim surgeon. His name is Abul Qasim al-Zahrawi. And he's known in the West as Abul Qasis. Al-Zahrawi was a Spanish Muslim surgeon, and he worked for Khalifa Abdurrahman III, all right, who established the Umayyad dynasty in Cordoba. And he is recognized as the father of modern surgery for many things. First of all, because he had major contribution in the field of surgery, all right? But also because he lived at the time in Europe, surgery was belittled. The church has banned it, and for those wealthy people who will want to practice surgery, they will actually go to barbers and butchers. These were the people who actually practiced surgery. It wasn't physicians, it wasn't surgeons. So Al-Zahrawi, he wrote eyewitness accounts of his surgical works and those of his peers, of his colleagues, in this compendium of 30 volumes, he called it Al-Tasrif, which covered a huge range of surgical procedures, but also he covered medical conditions and surgical tools. So Al-Tasrif was the first medical literature to introduce and illustrate over 200 surgical tools and instruments. And he provided details of how and for what to use them. Many of those tools and instruments are still in use in the modern day medicine. This is the pages of Al-Tasrif, and because it's a 30 volume, so people have attempted to translate different volume for different purpose. The one that you see on the right is specifically the volume related to surgery and instruments. It's available in English. It was translated in Latin in the Middle Ages, but you can get it in English from Amazon today. Al-Zahrawi's Al-Tasrif was a landmark in the history of surgery, being the first rational and complete illustrated text on the subject. This 30-volume treatise was the most comprehensive source of medical knowledge because it covered not only surgery, but it covered medicine in general. And there was some volume dealing with orthopedics, obstetrics, and gynecology. You know, these are related to women, ophthalmology, pharmacology, even nutrition. Many of the surgical procedures and instruments described and illustrated in Al-Tasrif did not appear in any other work of his time or before. So this is something totally new. The Al-Tasrif was translated into Latin in the early or middle 12th century by Gerard Cremona. He was a famous translator who translated from Arabic into Latin. All right, and this is help to introduce, you know, medical and surgical knowledge to Europe. What you see on the right is the front cover of Tasrif in Latin. With the reawakening of European interests in medical science in the 12th century, Al-Tasrif quickly became the standard reference for medicine and for surgery in particular, and it was translated later in other European languages. If we look at the 13th volume, which is the one that focused on surgery, you know, the translation that you saw before, it was of this volume. It was very comprehensive because it contained 3 sections and 19 chapters within this one volume. And it was the first independent and comprehensive surgical treatise ever written. Its unique content, the arrangement of the work, its clear diction, and its lucid explanation all contributed to its popularity and great success. Just to, you know, to give you an idea of how some of the Europeans who benefited from Tasrif and what do they think about it. You have this guy, William Hunter, in the 18th century. He's a famous Scottish anatomist and a physician. He used the Arabic manuscripts, so he studied Arabic, and he used the Arabic manuscripts of Al-Tasrif for his famous study of aneurysm at the University of Glasgow. This is a guy, and if you want to know what is aneurysm, it's a vascular surgery of a bulge in a blood vessel caused by the weakness in the blood vessel wall. There's another guy, Guy de Collier. He's a French, and you know, he lived in the 14th century. He's a famous French physician and surgeon, and he wrote about Al-Tasrif. He said it was nothing less than the greatest achievement of medieval surgery. He quoted Al-Tasrif over 200 times in his own treatise on surgery. Now, of course, modern surgery is a highly precise and sophisticated activity reflecting culmination of centuries of innovation by dedicated physicians. But we should not lose sight that this journey of modern surgery did not start today and did not start with the European Renaissance. It started more than 1,000 years ago with Al-Zahrawi in Muslim Spain. Now, Al-Zahrawi, he pioneered many things, and I will just highlight some few to appreciate. He pioneered the use of what is called catgut for making internal stitches in an operated patient, that is still used today in surgeries worldwide. You know, I talked to my nephew who is a doctor. When I mentioned catgut, he's familiar with because he's using in the surgery. What is catgut? Is a thin natural fiber made from an animal's intestine that when used to stitch operated area, it will be absorbed by the body such that the patient doesn't need to visit the hospital again for removing the stitches. This is very important when you do internal stitches, like, you know, women who undergo, for example, abdominal pregnancy or cesarean, as they call, you know, they're being stitched from inside and from outside. So in the past, and I think this is what made Zahrawi started to look for some alternative, because he did perform abdominal pregnancy operation. And, you know, he needed the woman after the operation to come back, you know, maybe a week or 2 weeks later, and operated again in order to remove the stitches from inside, and then to be stitched again outside, and then another week or another 2 weeks to come back for the removal of stitches. And this is what drove him to look for alternative. But at Zahrawi also, he developed forceps. This is a tool that is used by midwives to help difficult deliveries. This tool is still used today. He also developed something called lithotripter, a tool that was used for crushing blood stones. You know, 1,000 years ago, you know, you have this kind of sophistication. Al-Tasrif, which is, you know, in Al-Tasrif, Al-Zahrawi, he described how to correct dislocated shoulders. You know, today this has been given credit to Emil Theodor Kocher, and it's called the Kocher's method, all right? But it is described in Al-Tasrif. He also described patelectomy, which is a damaged patella, this round bone in our knees. He described this a millennium ago, before what is now given credit to Ralph Brooke, okay, who introduced it in 1937. He also, as I said, conducted ectopic pregnancy, which is referred today as abdominal pregnancy or cesarean. And it's just amazing at that time, you know, they didn't have X-rays, they didn't have many of the tools that modern medicine has, and yet they were able to do this. He set broken bones in plaster cast, which we still do it today, and he replaced missing teeth with the bone replicas, and he performed amputations. He developed a fine drill and inserted through urinary passage to crush stones in the urethra. He also demonstrated how to remove debris of the crushed stones from the bladder. He also performed tonsillectomies or tonsils surgery for the first time, and he developed very interesting tools, you know, just to make sure that when they remove the gland, it doesn't choke the patient. And he identified the hereditary nature of hemophilia, which is a condition where the blood doesn't clot. So people who have this condition, when they cut themselves, you know, the blood keep running out. It doesn't clot easily. Now, although surgery was still dangerous and painful at that time, but Al-Zahrawi, he developed many tools to make it relatively easier and safer. Al-Zahrawi also was the first to stress the physicians to study the basic sciences of anatomy, physiology, and functions of the organs before practicing surgery. This is what is done today in medical schools. And he also stressed the importance of specializing. He was the first to introduce use of cotton in surgical dressing. and in controlling blood from cuts and the ruptured vessels, all right? And he was also the first to use cautery, wax, and alcohol to control bleeding from the skull during cranial surgery. Cautery is, I think, something like hitting the nerves or something. The doctors know this. As I was reading, I was overwhelmed myself. And he described the ligature of arteries. This has been given credit to French surgeon Ambrose Paré. He was the first to describe and performed on emergency cases tracheostomy, which is a hole in the windpipe to help a patient to breathe when they can't breathe naturally. And he also wrote about orthodontic, which is a treatment for misaligned teeth. Today, tracheostomy is very important for COVID-19 patients. Abu Marwan ibn Zuhr, he's a 12th century Muslim surgeon from Seville in Andalusia. He performed tracheostomy many times, all right, as it was discussed by Zahrawi in his Al-Tasrif. And tracheostomy is a surgery that involved making a hole in the windpipe to aid patient who is unable to breathe normally, as you can see in the picture. And today with COVID-19 pandemic, tracheostomy surgery has become sort of a standard procedure. You know, if you cannot breathe naturally, and if they want to put you on ventilators in intensive care unit, you know, this is what they do. It's amazing that, you know, this surgery was done almost 1,000 years ago. Now we move into another area that Muslim contributed, and this is the area of ophthalmology or eye diseases. Muslim physicians have been in the forefront, you know, of effort to prevent blindness, you know, and they've done this for over a millennium. Yeah, Muslim ophthalmologists or eye surgeons from 10th century, they were performing eye operations, they were dissecting eye, they were discovering various eye diseases and their treatments, and they were writing about it. You know, the ophthalmologists, they also produce accurate diagrams of the anatomy of the eye. Most of the terms that we use to describe anatomy of human eye today, they are actually translation from Arabic. So things like, you know, retina, uvea, cornea, lens, and all of these are actually coming from the Arabic terms. They also, you know, dealt with diseases like cataracts and trachoma, which are still a problem today, intraocular pressure, but they were treating them. They were performing, you know, surgery on this regularly, and they were also with a high degree of success. Among the most important, you know, eye surgeon is this guy who lived in the 10th century. He's an Iraqi physician. His name is Ammar al-Mawsili, okay? And the Mawsili maybe because he comes from Mosul in Iraq. And he invented a hollow needle for sucking cataracts out of patients' eyes. And, you know, cataract, for those of you who might not know what it is, it's the, you know, the accumulation of water in the eye's lens that makes the eye soggy. So Al-Mawsili, he developed this tool to do that, okay? And this procedure is similar the way it is done today, but of course there's improvement today, more precision. Another important eye specialist at that time is this guy, Ali ibn Isa al-Kahal. He was from 10th century Baghdad, and he wrote this very, very important book, Notebook of the Oculist, or Tazkirat al-Kahalin, which is a landmark treatise on ophthalmology that is often cited as one of the most important works of its kind in the Middle Ages. this book, this notebook of occultists, was translated in the 15th century, and it was printed in Venice, in Italy. And there is interest in this book even in the modern time, because there was a German translation in 1904, and there was English translation in 1936. So it means that people still find a value in this work. In this notebook of occultists, it was considered, first of all, as an authority on ophthalmology for centuries, because he described more than 130 eye diseases, including various forms of cataract, glaucoma, ophthalmia, and others. But Ibn al-Kahal, he also described in detail these 130 eye diseases, and he classified them by their anatomical location, drawing upon earlier sources, but also adding his own observations and findings as he practiced. And he broke it down into, 3 sections, all right? Al-Kahal is also credited with the prescription of anesthetic for surgery, and he discovered symptoms of what is today known as Vogt-Koyanagi-Harada syndrome, which is an inflammation of the eye and loss of vision. He already described this, 1,000 years ago. He was in his book, Ali bin Isa al-Kahal, also, he makes an argument that defective vision may be due to other ailments of the body, which is not necessarily directly from the eye, but from other parts of the body, okay, which impact, the eye. And there's another physician, Al-Jurjani, who agree with this, and he wrote a famous book, The Light of the Eye, okay, and he described things like nerve paralysis or blood disorders or blood toxicity, can impair the eye vision. All right. There's another one, famous one, when you read from Cordoba, Al-Hafidh. He wrote The Right Guide in Ophthalmic Drug, and his treatment of trachoma was carried out until after the First World War. Okay, so we move now in the area of orthopedic. Of course, there were many other physicians and surgeons in the Muslim world who carried out groundbreaking works in different areas of medicine. And one exceptional example is Ibn Sina, who lived in the 11th century. He's from Uzbekistan. Ibn Sina specialized in bone fractures, and he is considered as the father of orthopedics because he gave us so much about orthopedics that is still being used today. At that time, they were not referring to this as an orthopedic. This is today's nomenclature, but they were describing as a bone fractures. And he's the one who developed methods of treating bone fractures, different methods, including use of gypsum, which is quite common today. Now, he wrote maybe, 276 works in Arabic, out of which 43 were in medicines, but only 68 of his works survive, and they are available today. The West, they like him so much, and they call him in a Latinized name as Avicenna. And some West, they give him a nickname as a Prince of Physicians, or the Galleon of Islam. His most important and famous work is his medical compendium referred as Al-Qanun fi al-Tib, or the Canon of Medicine. Now, Ibn Sina's Canon of Medicine, or simply the Canon, became highly influential in the Muslim medical community. And it was translated in the 6th century into Latin, and it became also standard text in Europe. if you go to any European medical school at that time, until the 19th century, you know, you will be studying Ibn Sina's The Canon. And the Canon was replaced by a medical encyclopedia called Gray's Anatomy in 1859. But even Gray's Anatomy, it was influenced by the Canon in terms of the layout, you know, of the book. And many of the modern medical books were influenced by the Canon. So this is Gray's Anatomy. All right. It was not abnormal to see many of, you know, Muslims' literature on medicine, you know, translated from Arabic to Latin and later to modern European languages. And of course, these are the ones who were distributed in Europe and played a critical role in spreading medical knowledge in the West. Ibn Sina's Canon of Medicine is considered a unique medical reference because it contains cumulative medical knowledge from ancient period until the time it was published. It was also, it was very close to the way a modern medical textbook follows, you know, in terms of classification, you know, of various diseases or situations, medical situation, causes of diseases, epidemiology, diagnosis, symptoms, signs, treatments, prognosis, you know, so most of the modern actually, you know, follow the modern medical textbook, they follow the Canon. All right, and the Canon remained in use in medical schools, as I said, until, you know, towards the end of the 19th century. In 1980, UNESCO honored Ibn Sina, especially in his contribution in medical sciences. This is the Canon. It was in 5 volumes, and each volume specializes in particular area. In the 4th volume, is the one that has got treatise on bone fractures. And he organized it nicely. He talks about fractures in general, and then he talks about fracture for every bone. So you can see, you know, he talks about fracture in general. So the type of fracture, the symptom, the signs of a fracture, you know, what kind of pain you get, the swelling and deformity of the limbs, diagnosis, you know, factors that will stimulate or inhibit healing, all right, the principle of splinting the bone, all of that, and all kind of recommendation. And then he discussed about fracture of every bone. So you have a nose bone fracture, you have a vertebral fracture, you have forearm fracture, you have a finger bone fracture, you know, very, very detailed, even by today's standards. Just to highlight some few things from the Canon, at the beginning, okay, we already said that he talks about general and specific. He discussed about, you know, when you have a fracture, you need to delay splinting. You don't do it splinting immediately. This idea of delay, he described the 5th day. So this idea became a theory of delayed splintage, and it is credited to George Perkins. But it's very clear in the Canon. He also described a thumb fracture, which is 1,000 years ago, which has been credited recently by Bennett, Halloran Bennett, which is referred as a Bennett fracture. And, you know, in the West at that time, they thought if anyone wants to be a good doctor, he must be an Avicenist, meaning you have to follow the footsteps of Ibn Sina. Okay, now I want to quickly, because I'm running out of time, I will go through pulmonary circulation. I think I've covered this material before, but just quickly. Gallen was the first to theorize human blood circulation, which he thought blood from the liver, it reached to the right side of the heart through invisible pores in the cardiac septum. And then it goes to the left side of the heart, meaning, the blood moves between right and left through some kind of media inside the heart itself. And William Harvey was claimed to have unseated this Gallen's theory for the discovery of the correct blood circulation through the lungs. But in 1924, they discovered manuscript which consists of a commentary on Ibn Sina, the canon, by a Syrian physician, Ibn Nafis, who actually in 1242, he described correctly the pulmonary circulation. So, he the one who described that, the blood actually doesn't go from, from one chamber of the heart to the other chamber of the heart directly, but it actually goes outside through the lungs. And in 1957, 700 years after his death, the international medical community, they recognize Ibn Nafis as a true discoverer. And this is thanks to this Dr. Muhyiddin al-Tatawi, who actually found the manuscripts in 1924. Now, moving into pediatrics, we have this very important, very famous, very bright physician, Abu Bakr ibn Zakaria al-Razi. And he was among the outstanding physicians and medical scholars in his time. And he made a notable contribution in the field of theoretical and practical medicine. So al-Razi, he followed Hippocrates and Galen in his works, but he combined this Greek theoretical medicine with his clinical observations. And that's why al-Razi, he rejected several of the claims that were made by these great Greek physicians, which were not in agreement with his clinical observations. Now, he wrote doubts about Galen, okay, in, at that time, after he started to practice what is called evidence-based medicine, based on empirical science. For example, he was the first physician to introduce urine analysis for diagnosis of illness. Al-Razi was an original physician and a medical scholar, especially in clinical medicine. Now, he wrote a very famous 9-volume encyclopedia, which is called Al-Hawi, or The Virtuous Life, which was the first, which was translated in Latin in the 13th century. And it became known in Europe as Continence Liber, that will in Arabic translate as Jam al-Kabir, because of its comprehensiveness. Al-Hawi represents various medical topics and many innovative views that led many scholars to consider Al-Razi as the greatest physician of the Middle Ages. So this is Al-Razi. He wrote many books. He wrote over 200 books and treatises. In medicine, you can find many interesting titles here. For one, Without a Doctor, proving the science of medicine. He wrote about kidney stones. He wrote about liver, about intestine. All right, but he wrote a very important 2 books related to pediatrics, to children's medicine, and that is The Diseases of Children and the Treatise on Smallpox and the Measles. This is the picture you see on the left. This is the cover of the Latin translation, which was done in the 12th and 13th century. Now, Al-Razi also, he was the first one to introduce this idea of clinical trial. All right, so he divided his patients suffering from meningitis into 2 groups, an experimental group that received the treatment and a control group that did not receive the treatment. And he then compared the result of the control group to the experimental group to see if the new treatment actually works. So this kind of clinical trial is referred as a single blind experiment, since only the researcher knows who receives the treatment and who doesn't, until the experiment is over. And today we have also double-blind experiment, where both patients and researchers are unaware who receives the treatments and who doesn't until the experiment is over. But what is important is this idea of single-blind and today double-blind, the clinical trials, they have become universal standard in the medical and the clinical psychology fields for investigation, whether when we're dealing with new treatment or when we are dealing with drugs or when we're dealing with new vaccination. You know, you have to go through these ways or these methods in order to ensure impartiality. And this is thanks to Rawahy. There is a video, but I will skip this just to save time. When you download your slides, you can watch that. As it was said, Rawahy, he wrote a treatise on smallpox and measles, and he provided clinical characteristics of these two diseases, which was in the past, it was considered as to be one. And it was Rawahy actually who described them as a distinct diseases. You know, Rawahy, he composed his treatise on smallpox and measles in 14 chapters, and he included Gallen's work, who did that before, and even Hippocrates, he did that before. But in one of the chapters, and except he added his own clinical trial, because he didn't base only on theory, but he actually based on the experiments that he did. So in Islamic civilization, medical knowledge of children's health and illness developed as its own genus, its own department a millennium ago, separate from adults' health and illness. They realized that they needed to deal with children separately from the way they dealt with adults. So there are many Muslim medical encyclopedias and books and treatises that specialize in children. One of the common one is this Firdaus al-Hikmah, or the Paradise of Wisdom, that was developed by Ali bin Rabban al-Tabari. Okay, you know, he also authored another one entitled Risala fil Ilaj Atfal, or a treatise on the treatment of children, which were translated, all these books, into Latin and distributed in Europe. But it was Rawahy who was the one who actually made organizational separation of children medicine as a independent medical branch from other medical sciences. His treatise of on smallpox and measles, it dealt with the issue actually with children, right? But he also wrote another treatise on pediatric diseases, or Risala fi al-Amrad al-Atfal wal-Inaya bihim. Okay, which has also become a very important book, and it was translated into Latin and in many other European languages. And therefore, for this reason, Rawahy is considered as the father of pediatrics. On vaccines, inoculation or vaccination is a process where a person is given a small inactive dose of a disease-causing organism in order to stimulate the immune system to produce antibodies to fight this specific disease. And today they have some other ways of doing this with, you know, what they call this mRNA, and, you know, without going into that, most of you are familiar, you know, but the drugs were the first to discover this idea of vaccination, and they are the first one to inoculate their children with the cowpox taken from the breast of cattle. As a result, the children will not develop these diseases like smallpox and chickenpox. And it was in the 18th century, this lady Mary Montagu, the wife of the British ambassador to Ottoman Empire, is the one who brought the idea of inoculation of smallpox vaccination first to England, and later it went to Europe. And for more than 200 years, vaccines have made an unparalleled contribution to public health globally. You know, considering the list of killer diseases that terrified various populations, you know, and now are under control, just to mention few like polio, like measles and others. All right. This picture, it shows an 1802 caricature showing Dr. Jenner vaccinating patients at a special hospital, St. Pancras Smallpox Hospital, when they introduced this vaccination in England. And from these images, you can see there were a lot of, you know, at that time as well, they had these conspiracy theories about vaccination, you know, people turning, you know, like zombies, or turning, you know, they were afraid that this vaccination will change them. I have this last section on pharmacology. I don't know, Dr. Yusuf, should I continue or should I stop?
Continue, Sheikh Hafidh. Is interesting. I think people will be able to save some time for.
Okay, so you make maximum 10 minutes, inshallah. This is another important area of pharmacology, and I will start with the herbal medicine. In the Islamic civilization, herbal medicine was not an alternative medicine as we see today. It was very much part of the medical practice at that time. And the Muslims were the first to develop botanical gardens, and these were developed and they became like scientific fields, laboratories, and pharmacies. And many hospitals, they actually kept botanical gardens, which had a full of herbal plants for use and, you know, as drugs or in drugs preparation. And there were people who specialize in this area, who were researching in this area. Among important works on herbal medicine is the 10th century Ibn Samajun, who wrote collections of simple medical plants and resulting medicines, where he classified plants and their medicinal properties. And Ibn Sina's, the canon also, he listed about 142 herbal plants, you know, with the herbal medicinal remedies. What helped to propel herbal medicine in the Muslim world? Three areas or three development. First of all, botany, it really became an academic science. You know, the study of plants, it became an academic science. And also the Muslim developed chemistry. And therefore chemistry was advancing at an incredible rate. And also because of this scientific method or methodology of observing over a long period how the herbs will affect the patient. So all of this actually helped. Andalusia was a springboard for herbal medicine development, and especially because there was an agricultural revolution in Andalusia. So the first royal botanical gardens actually in Europe appeared in places like Toledo and Seville in Andalusia in the 11th century. And one of the very important Andalusian scholars on herbal medicine is this 13th century Ibn al-Baytar. You can read about him. His books are available and have been translated. I think you can get even in English translation. Now, today, almost nearly every business street and in most shopping centers and malls, we have a pharmacy or a chemist. But we have to realize this is not a modern day concept. Pharmacies sprang up in Baghdad, in Cordoba, in all other Muslim cities a millennium ago. And at the beginning, pharmacies, they develop as independent family-run business, okay? And they operate in the market, but they were inspected by the government by appointing al-muhtasib, you know, like an inspector. And this goes all the way to the time of Sayyidina Umar. He actually recruited a lady, a Shifa, who was in charge of making sure, you know, medicine and even food products of standard, and there is no any cheating or in terms of either in the ways of measures or material or any kind of irregularity. Hospital had their own dispensaries producing pharmaceutical preparations in real time. And I think some of us who are old enough, we remember the early days of pharmacies. You know, you didn't get all the time medicine that is already pre-packed. You will give a prescription to a chemist, and the chemist will go behind the scene to mix for you. And then they will put in capsule and they will give you. All right. So the pharmacology industry was well developed and supported by medical scholarship, because you have people like Sabur ibn Sahal, who was the first physician to describe a large variety of drugs and remedies for ailments. You have a Razi, who promoted chemical compounds in medicine. You have Ibn Sina. In his canon, he described 700 preparations in volume 2. Natural pharmaceutical. You can find in this volume 700 preparations, their properties, their actions, their indications. And you have Al-Kindi, who determined the correct drug dosage as the basis of a medical formulary. You also have the Rawahy, who pioneered the preparation of medicine by sublimation and distillation, taking advantage of the advancement in chemistry. And you have Muwaffaq al-Harawi, who described these two elements which are used today in pills to form a protective membrane coating in order not to irritate your stomach. And this is the last slide. In the 11th century, Al-Biruni, who was a polymath, but he wrote one of the most valuable works in the field of pharmacology, the Book of Pharmacology. And in this book, Al-Biruni, he gave not only detailed knowledge of properties of drugs, but he actually outlined the role of pharmacy and the functions and duties of the pharmacist. So the early drug treatises by Muslims were enormous, and when translated into Latin and passage into Europe, with all their vital pharmaceutical knowledge, they highly influenced Europeans in establishing the pharmacology industry. Shukran wa jazakum Allah khair for listening.